Now, we all know how important a good night's sleep is, but a huge number of people are actually struggling to achieve it. Now, for many, snoring might seem normal, but it can also potentially be a sign of a serious medical condition called sleep apnea. Apnea means no breath, and it's this temporary but repeated stopping and starting of breathing that's linked to a whole range of health problems, including some severe as heart attacks and strokes. Now, Laila bin Hareb runs Alive Medical, and they specialise in the testing and treatment of sleep apnea. She's also an internationally certified hormonal health practitioner and qualified executive member of the International Practitioners of Holistic Medicine. And we are talking sleep apnea this afternoon. We're going to be having another expert joining us from the world of ENT after 2:30 today. So if you've got any questions, concerns, you want to have a bit of a moan about your snoring or your partners, get in touch. Laila, thank you for being with us today.
Thank you for having me.
I know this is a topic very close to your heart. Can you tell us a little bit about why you're so passionate about bringing awareness to sleep apnea in particular?
Yeah, absolutely. I had a long career with the government. At the end of my career, after 28 years, I started looking at sleep apnea from an aviation regulator point of view. So we were looking at sleep apnea effect on fatigue management with the cabin crew, with the pilots, etc. But during that period of time, my mother was not diagnosed by sleep apnea, but she had a lot of medical issues. So she started to have she started being diabetes, and she started having hypertension, and then that led to a lot of cardiac issues, and we lost her, and she was young when we lost her. The thing is that we didn't know that she had a sleep apnea issue. She was snoring, she was gasping for air at night, but we took her to cardiologists, to other doctors, but nobody of her physicians, they noted this issue or even asked to have her sleep apnea diagnosed, or at least do a test or, a questionnaire or whatever. So we lost my mother very young, and then during aviation, I talked to sleep apnea doctors, sleep medicine doctors, and through my investigation, I realized that my mother had a serious obstructive sleep apnea, because we saw her symptoms at night. We used to sleep next to her when she was sick, and we could see that she was, every few minutes, she would gasp for air. And we didn't know what is that. We thought it's, related to her heart issues. But then when I investigated, I started doing a lot of research. I realized that if we really diagnosed the sleep apnea with my mother, we didn't lose her, and she will be with us today.
Laila, I'm so sorry to hear about your mum, and I wondered if you had, or the doctors had been able to connect those dots and give a diagnosis of sleep apnea. What steps would have been able to be taken? Because sadly it's too late for her, but there are so many people that could really benefit from an accurate diagnosis.
Yes.
What would have changed? What could have been done differently, do you think?
Well, there's a lot of things. I think there are four main pillars to change in the medical system. First, the primary care physician, they need to be aware. They need to have a protocol in order to identify the signs of sleep apnea and be able to send these patients for sleep apnea diagnostic. And then we need to make sleep apnea diagnostic more affordable, because it's extremely expensive right now, and we need to use artificial intelligence. We need to use innovation in order to improve the way we do diagnostic of sleep apnea. It has to be accessible to public. It has to be there from the public medical system or private medical system.
What does diagnostic treatment, or even getting a diagnosis, look like now? What are physicians looking for? What are experts such as yourself trying to establish in order to be able to get that diagnosis and then move forward? How does it work?
Well, we currently, they have sleep labs. We do have sleep labs. So a patient would have some time off, and they would be admitted to a hospital, and they will take a traditional sleep test. sleep test with all the cables, with all the wires, and it is not in their normal
this
location.
Is why I struggle with sleep tests like this, because I'm thinking, how are you possibly going to get an accurate depiction of what a typical night's sleep looks like when you are exactly in an unfamiliar surrounding and you're covered in cables? So.
Yes, and if you consider children as well,
exactly,
and that is not accurate at all. So this is exactly my mission. When I left the government, I retired. I started to do a lot of research. I researched all the technology available around the world. I researched the regulation about sleep apnea. I looked at the holes, at the gaps in the medical system, and especially when someone coming from from another regulatory sector, which is aviation, and goes into medical regulation. It's always when you have someone outside the system can really have an analytical eye to look at the holes, look at the gaps, and so I've seen a lot of things that has to be improved. There's a lot of improvement areas in our system, especially when it comes to technology and innovation in diagnostic. So I also researched and had a partnership with a company who is using artificial intelligence in order to diagnose sleep apnea. So they are looking at the mandibular movements and their algorithm and their home sleep test, and that is something was amazing, especially for children, because the number of cables and the number of things attached to a child, it was very minimal. Only 2 cables on their jaw and then on their forehead, and the machine is very small. It's a tiny machine that the child does not even notice while he's sleeping, and they sleep in their own crib, in their own bed, so they don't feel that
it's not foreign. Yeah.
It's not foreign for them. It's not uncomfortable for them. So you are really able to measure the right sleep cycle.
I want to know just how common sleep apnea is, Laila. When we think about how many people are affected knowingly or unknowingly, do we have any data on it?
The last data we got from the American Sleep Association, which is basically 23% of the population, they have sleep apnea.
Wow.
And actually 20% of those people are diagnosed. So 80% of sleep apnea around the world is undiagnosed.
Wow.
Which has huge impact.
It's got a huge impact on their individual lives. I'm sure their family lives.
Yes,
and the
absolutely.
healthcare system as well. Let's hear now from Bert, who suffered from sleep apnea and was eventually diagnosed.
The way I knew I had a sleep disorder was the amount of snoring that I was doing during the night, as well as waking up countless times during the night. No matter how much sleep I felt like I did get, I was tired every day. Whether I went to bed early or late, no matter how long I felt I had slept into the day, I constantly felt tired. I was officially diagnosed with sleep apnea. I was actually stopped breathing up to 100 times a night and as long as 35 seconds at a time. It was very important for me to go to the sleep center and get this taken care of, simply because I was tired of being tired all the time.
There's a bit saying no matter how early he went to bed,
yes,
no matter how much sleep he got, he wasn't getting the quality of sleep in order to feel rested.
Mm-hmm.
So let's talk techniques and remedies. What have you seen to be successful in this area, Laila?
Well, we provide only one kind of treatment right now, which is the oral appliance. The oral appliance is a non-invasive treatment for sleep apnea, and I think it covers 80% of those cases where it is mild and moderate, and sometimes it works for severe sleep apnea. This is much better choice from surgery, for example, and better choice actually from CPAP, where there's a lot of cases where you need CPAP if it is severe or very obese.
For anyone who's not familiar with CPAP, can you explain what it is?
Well, it's a machine that it will, push the oxygen, so it will increase the oxygen level.
And you wear it on your face?
You wear a mask next to a machine, next to your bed, and it has a sound, and you carry it all everywhere.
It's a bit Darth Vader-y.
Absolutely. It's not it's not the favorite treatment, especially for married people, because it really affects their marriage.
Mm-hmm.
Who wants to
it's
sleep next to someone?
Romantic.
No, not at all. So an appliance would be more suitable.
And
for
what
these
does that look like? Can you explain how it's used, what it looked like?
Yes, an appliance is similar to a night guard, but for up and down teeth, and they have it has a connector. So the connector between the two night guards, for example,
Like a hinge?
like a hinge, which ensure the airway is or you have an airway open during the night. So it will affect your jaw placement during the night, and you will have an open airway. And actually, it will exercise your tongue and your upper airway muscles.
So that's what I wanted to ask you. Is this something you have to use for life, or eventually is your body going to respond to that appliance and be able to do that on its own?
Absolutely. There's a lot of cases we have saw that they have stopped using oral appliances after years, but it depends again on your lifestyle. So if you are obese, if you know...
Why does weight play such an important role on sleep apnea?
Well, it's a vicious circle actually between weight and obesity and sleep apnea. So if you have sleep apnea and you have lack of oxygen and you have high carbon dioxide, and then you have a metabolic issue in your body, and then you will have issue with weight loss, and you will put the pounds on your body. And then if you don't have a sleep apnea and you have a lot of fat in your airways, that will cause sleep apnea as well.
Okay.
So it will reduce the airway size in your mouth.
Now let's go back to the jaw. You were off air recommending me a bit of reading for me, but I've heard you that you can also look at somebody, even a child, and perhaps have an idea they might have issues with sleep or sleep apnea.
Yes, well, physicians...
What are you looking for?
Physicians, they look at the face and they look at the jaw. Now, the jaw is very important to have the right bite in order to have the right airway.
So it's
airway
functional.
size. So it's functional. So if you see a lower jaw which is going retruded to the back, you will find most probably they have a sleep apnea, because that affects the airway.
Now, I just had my airways assessed a few weeks ago. I went with the whole family because a good friend is an airways dentist, and she actually said to me about my 5-year-old, you might want to get her checked. And she is a thumb sucker. And sure enough, we all went in, and actually both of the girls do need some kind of appliance in order to expand their jaws as well. And I found out after 40 years on this planet that I have got a severe tongue tie. So I think I might need to have that dealt with. So I'm wondering if you could look at me now, would you suspect there's any issue at all or not?
No, actually, no. Not from where I'm sitting, but I'm not a physician again.
No, well, we are going to be talking to an ENT.
Yes.
Laila, I just wanted to play out one of your patients. This is Claude, who has been working with you.
I snored a lot. My father was suffering from sleep apnea. To avoid reaching his stage, I looked for solution, and that's how I used the dental orthosis, which changed my life. Because my wife sleeps all night in our bed, the quality of my nights is better, and I am in better shape.
Better shape, relationships in better shape. Laila, if anyone wants to reach you and indeed find out more about being tested, which I think is a real point of difference for everything that you're doing with Alive, what's the best way of getting in touch?
We have our website, alav-med.com, and we deal with a lot of hospitals and clinics. So if they contact us, and we will refer them to a specialized physician who's using our diagnostic and treatment.
Laila, thank you so much for your time.